just at a high level, maybe where is Africa at the moment when it comes to the digitization of primary data, not only collecting that data, but then meaningfully doing something with it, analyzing it and putting it into the right place in order for there to be an effect on the end beneficiaries, the patients in this case?
Yeah, if there was one word to describe what Mezzanine does, it's that word data. It's about getting a torch basically and being able to shine it for your client to be able to generate and consume, that data in order to inform, decision making and so forth. And right now, I think it's fair to say that
right.
in almost every healthcare system, primary care level data is collected on paper. There are very few systems that are out there, digital systems, that have been deployed and have remained successful and or have scaled. Very few.
And when you say paper, you really do literally mean paper?
100%. Yeah. When we first set the first version of mVacciNation, which we took to Mozambique and then to Tanzania and then to Nigeria,
right.
where we captured, I think, 1.3 million vaccinations. We'd go there, you'd sit outside these facilities and, as you would expect, there are just rows and rows of moms and their kids and whatever. Literally like hundreds. And you walk inside and they have different stations. And, one station is where they weigh the baby and then they record that in a register, literally like this size. And then the next patient baby gets put in the sack and weighed, and then they go to someone else and whatever. And when they get to having the vaccination actually physically done, there's a book. I kid you not, you would probably need a Land Rover to carry this thing. It's so massive. It was known as the Vaccine Register, I think it was, for obvious reasons. But it literally was going back years. But that was the thing, that single book.
That was it.
That was it. That was the repository of all the data. And it was respected and they looked after it and they paid huge attention and care to this thing because that was their single record.
Right.
But what they then used to do was to copy that, what they'd captured every day, on another piece of paper. They would give that to someone, they'd go to the next facility and they would collect that piece of paper and the next piece of paper. Then that would go up to the sub-district person, a data capture. He would amass all of it and create one piece of paper. Then we go to the district and they would collect that. And then finally someone would enter it into an Excel spreadsheet, which then got put into a USB, got put into a car, and days later or weeks later would land up in the capital and so forth, where people would eventually look at the data. So people have long used these legacy paper-based systems, and as I've just outlined now, it's complex, it's expensive, it's prone to errors. The veracity of the data is poor, and consequently, how can you expect people to be proactive about decision making when they don't even trust the data to start with?
Right.
And it's just difficult. Unless you've thought through the whole process, how do you actually is this data clean? What format do I need it in order to make intelligent decisions and so forth? So that's exactly what we do and so forth. So being able to now digitize key components within the value chain. If you take vaccines, those core components relate to the stock and around the beneficiaries and so forth. And how do you manage them individually and then together to extract that data that enables you now to connect this piece of stock to that specific individual? And that's exactly what we've done now with mVacciNation.